Hi, I'm Dr. Amber Luong. I'm an associate professor within the Department of Otolaryngology at McGovern Medical School at UT Health, associated with Memorial Hermann Hospital. I want to thank everyone for your interest in our CSF leak video. There was a lot of interest, and then there were a number of questions that I was hoping to try to address at this time. Oftentimes, these brain fluid leaks or CSF leaks can happen spontaneously. It's actually called spontaneous CSF leaks. And this happens because there's elevated pressures within the brain, which then causes the pressure of the fluid to be high. And over time, it can erode the bone that separates the brain from the sinuses. And then with the erosion can cause a break in the bone, and therefore you can have a brain fluid leak. If you are ever experiencing clear fluid leaking out of just one nostril, you should go see a doctor immediately. It is very uncommon to have leakage from your nose, let's say from allergies or just postnasal drainage, from non-allergic rhinitis or a cold or irritation from coming out of just one side of the nasal cavity. So usually in those situations you have clear fluid coming from both sides. If in any situation where you're having clear fluid only from one side, you should go see a doctor as soon as possible. If it's one-sided leak or clear fluid leak on one side only, then it's unlikely to be due to a prescription or foods. However, sometimes there are certain foods, such as spicy foods, that can cause you to have an increased drainage, and there it can cause you to have leakage from your nose. Very few medications cause you to have drainage. In fact, most medications will cause your nose to really dry up rather than to have drainage. Clear liquid is more consistent with a potential brain fluid leakage. However, clear liquid can also come due to allergies or just irritation as from a cold. When we think of colored drainage, that's where you think of more during an active infection. That being said, discolored drainage doesn't necessarily mean that you need antibiotics. Discolored drainage just means that the immune system is being recruited, and then some of these cells may have leaked out into the fluid, causing a yellow or green discoloration. However, the only way to differentiate between bacterial and viral is based on your other symptoms that may be consistent with a cold, and then if it lasts for longer than 7 to 10 days, it's more likely to be bacterial cause and where you may require antibiotics. But if it's just for a short time, discolored drainage may not mean anything. It may not require any other medication. So multiple leaks can be caused by elevated intracranial pressures. So as I'd mentioned, if you've had elevated intracranial pressures, especially for a number of years, it can cause the skull base to erode in a couple of different areas. That being said, it's still pretty rare to have multiple leaks. What I more commonly see is if you have a leak at one point in time and you may require repair surgically for it, then maybe down the road, then another leak may pop up, because as you can imagine, when you have one leak, then it decreases the pressure, so it's unlikely to develop another one. However, by repairing it, you can't, and not addressing the elevated intracranial pressures, over time another leak can develop. But again, it's very rare to have multiple leaks. Why some people re-leak is either A, the pressures in your brain are so high that the initial repair was inadequate. Luckily, that's not very common. More common to happen is if you have elevated intracranial pressures and it's not recognized or not treated by either medications or follow-up with the neurologist, then you can develop a leak at another site. So it may seem like a re-leak, but actually in another site. But again, luckily it's very uncommon. Some things that are associated with elevated intracranial pressures is weight gain. So if you feel like you've had a history of a brain fluid leak and it's confirmed, and someone has told you that they're concerned about elevated intracranial pressures, weight loss is a very, not easy, but it's a manageable option to decrease that intracranial pressures without medication. Thank you so much for all of your questions and your interest in this topic. If you have any other questions, feel free, or you feel like you need to see an ear, nose, and throat doctor. I am located at UT Physicians in Houston, Texas. We're located at 6400 Fannin. The clinic number is 713-486-5000. Thanks again.